depression started pretty early in my life. I was an abused child, and I had a lot of depression from that. Then our son died 20 years ago, and major depression. And then more recently, what was strange about the most recent, that's probably lasted like maybe a couple years, but there was no reason for it. It was just really just like a sledgehammer. I just couldn't. I lost all interest in everything. Everything I did, I paint and I write, and I lost interest in those things and the arts, which I love. Nothing meant much to me all of a sudden, and then it lasted for a couple years, and it ended up where I was just suicidal. I didn't want to do this anymore. Seems like I was just so tired and in pain all the time. Yeah. So I tried to complete suicide, and my husband came to the rescue. The police and everybody else. But my husband came to the rescue, and we got back home and took me to the doctor, and he said, get the name of 3 psychiatrists. I'm going to call you back. I want to know their names because of COVID. He said they're so busy now that a lot of people don't have room for you, so you'll have to call several. And so he was on the phone and calling, getting someone, and his first call was Dr. Griffith, and it was just, it was like, a little later we found out it was like a miracle. When we first came in, we talked to Cassie, and she was telling me about TMS. I've been on antidepressants since my son passed away, and like you were talking about earlier, it just kind of lost its power, I guess. And Cassie was telling me about TMS and thought that I would be a good candidate for it. And I was skeptical. It sounded a little bit crazy. And but I agreed because I was desperate, and because I had people behind me that felt desperate too, and wanted me to get help. And when I came in here, it was just automatic comfort with Cassie. And then when I met Dr. Griffith, and he just made me immediately comfortable. And it's like Bill has said often, it was just a miracle us finding him, and being aware of TMS for the first time, and that there might be other forms of help. Depression has affected my life in that it just stops everything. It stops my interest in life. It stops my ability to think straight. Even, it affects your mind in so many ways. I feel like I had physical pain from it sometimes, and it's just like heartbreak when there's no reason to have it. And I have a wonderful life, a husband who loves me. We've been married 50 years, a wonderful daughter here, and there was just, I can't reason it out why it happens. It's just a chemical thing, I guess. Well, what I've done in the past is I've had psychologists, and I've been on antidepressant, like I said, for 20 years now.
And did it work?
It did at first. It kept me from being so low, but after a while, it just didn't. I was afraid to get it off of it because I thought, well, it may be worse if I get off of it. Well, and also, well, I don't know what happened, but it just didn't seem to work anymore at all the last couple years. I wanted to try TMS because, as Cassie explained it, it was just like this hope she was handing me, because I thought I had tried other things, and I was really I don't know, it just opened my eyes. I thought, oh my goodness, there's something else. As crazy as it sounded, I thought, well, there's something else out there that I can try. And Bill could probably answer that better than me, but it's given my life back. I'm interested now. I'm painting again, and I'm writing, and I'm doing the things, and we go out and have fun and meeting people again. I just kind of isolated before, and now I'm out there again and always have something going on generally.
More consistent in our moods, and before the moods fluctuated a little bit more, you know, because the depression would set in, and of course that affects everything, you know, your depression and everything, and I just noticed a big difference in her since she did the treatments and everything. And
he would say often to me, he'd say, I have my wife back.
Yeah, for sure, because you were just so distant, you know. And of course, like I say, that coupled with seeing Dr. Griffith and fine tuning the medications and everything, I think it's a good thing. I'm a believer in it.
My concerns with TMS were that I wondered exactly, even after I had it explained to me, I wondered how something like that could work. Yeah. And I just, my concerns were, would it do something to my brain, or, you know, to make it worse, or I just had concerns about how it worked, how something like that could really work. And so I guess that was my only concerns with it. Well, I'm painting again. I love to paint. Hate to spend the money all over again because I got rid of all of it, anything like that. And people are wanting my paintings again, and it's just changed that. But I feel like I'm a creative person, and I feel better when I'm creating, and I had lost that to depression, and now that that's back, everything I do is creative, like the writing and crochet, knit, whatever, just always something creative, and it makes me feel better and good about myself, so I have that back. Well, I was surprised. I expected immediate, but it was about 2 weeks into the program or treatment that even my husband says, oh wow, I can tell such a big difference, and that I could tell a difference. I wanted to go out again. I just, you know, the isolation was just all encompassing, it seemed like, but have my friends, and we go out a lot, and I just got all that back.
Well, she just loses interest in life, and you become like no one exists around her. It's just that she goes into herself so much, and I know that she's just trying to fight this thing. And you know, anybody that suffers from that, it's not their fault. It's the way their body is reacting to something or other. And so if you remember that, it's much easier to deal with something like that. And I just kept telling myself, you know, that when she's going through this depression, and then when she tried to take her life, I realized that it's not her fault. We've got to get her help and everything. But depression's a terrible thing. To me, it's no different than cancer. It's just something that you can't see. You can see cancer in the microscope and whatever, but you can't see the depression, and it's just a terrible, terrible thing for somebody to go through. And somebody that's never had a family member or somebody that's never had a loved one that goes through this depression, or I think they may not be empathetic to it, because I think you have to be in close contact with it and you become to understand it, and you understand how terrible it is. Well, it got to a point to where for a period of time there, for about a year, it's just that, like I say, Nate, I don't know if it was, I believe the TMS helped immensely, but I also think that coupled with the great care of Dr. Griffith, but her depression was that there was no escape from this. It was just like she was going down a rabbit hole, and we couldn't get her out of that hole. And it just kept getting worse and worse, and you just start thinking, there's no relief from this. It's just going to go on and on and on. And then, like I said, we saw Dr. Griffith, and I never forget what he told Judy. He said, and Judy shared this with me, he says, Judy, we can win this, we can get through this. And those words were very comforting. That helped us to hang on. And but anyway, that, and then the TMS, I saw an improvement in Judy on medications after Dr. Griffith started with her toying with the different medications and everything. I saw an improvement, but I didn't see a back to normalcy improvement, just an improvement. But then when she took the TMS, that's when I noticed I had Judy back. I had my wife back, you know?
Well, my advice would to anybody that wants to try this, that wants to try the TMS, do it. I mean, if you're suffering from depression and nothing's working and the medication, I would 100% recommend TMS, because it's really changed my life.